Thank you, Yael, and thank you to both of you for inviting me to come lecture. So these are my disclosures. There are many. I do a ton of clinical trials, as Yael was just saying. Next slide. So if you click on the bottom, she had a significant problem, like I was telling you guys. So you see how she
having a
can't,
hard time also
she cannot close her
closing
eyes.
her eyes.
At all. So basically what I did is, like I was saying before, I put 2 units, and then 1 unit to pop her eye open because her eyes were very asymmetrical. She works for a large tech company. She lectures in front of thousands all the time, and she's very, very insecure about her eyes apertures being so, like uniquely different. So I said, okay, well, I've had no problems with this. Occasionally people have it so their eye doesn't close, like, 1 in a million cases, something like that. And then of course she's that 1 in a million case. And, she's my patient, we're friends. I was not particularly happy. So you're seeing here how her eye didn't close. Next slide, please. And if you click on this video, she was blinking so rapidly. You see that? How are you going to play that off?
So we can just have a conversation.
So she was blinking like that for 4 weeks straight after I toxed her. So my question to the panel is, in a situation like that, there's nothing that I could do. There's no antidote to get rid of, it was Botox I used in this case. There's no antidote for Botox to get rid of it faster. So I just gave her drops, obviously, so she could close her eyes. I gave her lubricating ointment for night. She did not wind up scratching her cornea, which I was very, very worried about. And then I just waited for the Botox to go away, and I've never obviously offered her that as a solution again. Any other suggestions from the panel at all for like how to make that blinking stop faster?
It's very rare that I am speechless.
Literally, like one of my oculoplastics friends was like, oh, you see that 1 in 2 million cases. I was like, I'm so excited.
So what was the initial, so the initial dose was the 2 units,
2 units and 1 unit.
But can you show the open
wait,
eye
let me just-
initial?
Yeah,
I'm
let's see.
confused about what.
Okay, wait, so, okay, I'm going to do it on this big one. So 2
sorry.
units right here, right?
No, just the initial pre-Botox
her
frontal view.
Pre-Botox? Well, I only have the post-Botox because I wanted to show the slides, but that's basically what she looked like. You see how asymmetrical her eyes are?
So her lower lid on the left is like it's struck. Is that from the tox? The scleral
Yes.
show laterally?
Yeah.
Is that from the tox?
Yeah.
So it's tox below the auricularis and the pretarsal
Right.
auricularis, you
Right.
have tox? So because that is open too much and this side not?
And the right side not, yeah. So I did, like I said, 2 units, and 1 unit here. And Steve Fagan taught me this years ago.
Sorry, yeah.
Okay, sorry. 2 right here.
And the upper lid.
Yeah, upper lid, medial, upper lid lateral, and lower lid lateral right there. 2, 2, and 1. So Steve Fagan from Florida Oculoplastics taught me that years ago, and I've literally had no problems with it at all. Any other suggestions to get rid of the blinking faster from the audience? No, right? Just tincture of time.
I would, this is a little bit going on the limb. I have to agree with Yael. This is so rare that
It's so
when
rare.
I try to open the lid, I don't do it the way Steve Fagan does it. I actually go more lateral.
No.
So unless there's someone has ptosis, in which case I go very close to the lash line.
No, I go right
Right.
on the lash line.
So I would have probably actually toxed her more to the blink muscle. I don't know what Brian would say, but I would have actually added some tox to actually calm down. Because if there's, when the auricularis isn't all in a congruity, so if we weaken one part of it, some other parts of it can overcompensate.
Yeah.
So my guess is that because of the way she uses her auricularis, weakening one part of it actually made some parts of it kick in more. And cause that blinking.
Yeah.
So my tendency would have been, without going in the lower lid and dropping her lower lid like the left side, would be actually to add some tox to some areas and watch her animate and
So
add
point it
some.
out on yourself. Where would you have?
So if you
Just point it
added-
on yourself.
If you had put it very close to the lash line here and here, I would have actually gone out to the orbicularis, but having watched her animate, that's why I was trying to see before.
Let's
And
actually play the
actually
video again.
weaken some of the
Can we,
orbicularis
can we play
more.
this video again one more time, please? AV, thank
Does
you.
that make sense, what I'm saying?
Yeah, this is a very interesting case.
Yeah, this is a very challenging case, thank you. So let me see. But it would be important to see the before.
So not this one, not this video, but the next one. Yeah, yeah, that one.
So we can just have a conversation.
Over there for some reason.
Okay, one more time. Can you play that one more time?
Can you play this one more time? For some reason, it wasn't working on this one.
So we can just have a conversation.
Yeah, I think I would have actually added.
Compensatory.
Compensatory.
So she's saying
yeah.
compensatory Botox.
Yeah,
Okay.
that's, because my
Interesting.
guess would be the etiology is somehow changing the balance between the different parts of the blink muscle,
And you would try to
which is the
rebalance it.
orbicularis muscle,
Yeah.
yeah. I don't know, Brian, what do you?
So is the right side only was injected, correct?
The right side only was injected.
I mean, I would increase the dose. I mean, I agree. I would just give her more neuromodulator.
I'm sorry, Brian, say
I
again?
would just give her more neuromodulator.
But not in the same pattern.
No.
No, probably not. And the thing is, it's a little bit hard to see in the video because all we're seeing is the end result of what's happening. To the excellent point Haida made, there are three components to the orbicularis: pretarsal, preceptal, and orbital. Orbital's not playing a role, but depending on where the injection was given, if you get pretarsal, you can get preceptal orbicularis that rides up a little bit. You know, maybe you'd have to really get the patients to animate, to squeeze, and where you can really see which portion of the orbicularis is active, and then potentially just add a little bit more in a little bit different location.
Okay. All right, I've got a bunch of cases to get to. Next slide, please. Okay, click this video for me, please.
If you feel extreme pain, if you get blistering, that is the beginning of a burn. That is worrisome.
Dr. Janine Downey is a board-certified dermatologist.
This laser is the XLV laser. It's good for all skin types.
She views these burns as a part of a broader problem in the beauty industry, with some providers rushing to get in on a hot trend, lacking medical knowledge and technical training.
There's a lot of people that will discount coupon their health and go to laser clinics that are staffed by people that learned how to use the laser the day before, and burns happen.
Certain lasers tend to be more effective in a wider range of skin types or shades, including machines that can easily distinguish the melanin the laser zaps in hair from the melanin in the skin.
The trauma of being burned by a laser cannot be understated because it did not have to happen. Because now, in
Thank you. And then I can only watch like myself for like a half a minute and then I'm like, okay, I'm done. So anyway, you guys get the picture. I show about 4 different people who had really bad burns. That Indian woman at the beginning, she was getting the laser the month before her wedding. And so she went, you know, like she changed what she was doing for her wedding in Hawaii and had to wear a swim shirt over her bikini to get married because she had so many bad burns. Obviously, that was not me that burned her. The whole thing was just a kind of a tragedy. This woman that I'm about to show you is Filipino, Native American, and African American. And basically, they burned the hell out of her underarms and her chin. Next slide, please. That's her chin. And by the way, she's a doctor. Next slide, please. And her doctor told her that this was normal. Next slide, please. Next slide, please. So she came to see me, and I gave her mupirocin. I gave her the ZO sunscreen, the gel sunscreen. That is UVA, UVB, anti-infrared, and anti-Hibble. Hibble is high-energy visible light. That's all the blue light. I was looking at the way she held her phone when I came in the room, and that may or may not affect it. We don't know, but assuming it does. She wasn't even using proper sunscreen at all. He told her she didn't really have to use sunscreen even after this burn, which I don't understand. I think she's a physical medicine and rehab doctor. So what I did was I did mupirocin, I did Strata Cell, which is the thick liquid Band-Aid, and I did vitamin C hydroquinone, like a half a drop every other day from Obagi, and then the alternate days I would do the 5% Cyspera, put it on, leave it on for 3 minutes, and then rinse it off. So that's got us to 1 week post-burn here that you're seeing. And then I did one of those Linder skin health peels, the woman that did the PCA peels that sold it to Colgate-Palmolive. Jennifer Linder's a friend of mine, so now she has lighter peels called Linder Skin Health, so I did one of those. Keep going, please. And obviously I was doing her chin and her underarms. Next slide, please. 22 days post the burn, you can see her melanin's really kicking up and repigmenting badly. So then I did a VI peel. I increased the amount of Cyspera in terms of how long, so I think I increased it to 12 minutes. And then the vitamin C hydroquinone I was letting her sleep with overnight, and I went from 1/4 of a drop to a half a drop on alternate nights. I stopped the mupirocin and I made her kick in. I felt like she was cheating on the sunblock because I told her to put a timer on, so she was putting on the sunblock every hour. And so I made her use the Color Science Powder Puff and put it on every hour because it's the middle of the summer and I don't want to hear that I'm not making her better. So I tend to be like, my husband was in the Army, by the way, when you were saying Air Force before. But yeah, I've become a captain in the Army. I'm not playing games with them. Next slide. Next slide. And then after that, she went on vacation for 3 weeks. She didn't get any worse. And I think that's all I have to show you guys. Next slide. The hyperpigmentation on the right armpit, for some reason, at the bottom, the burn wasn't even that bad there. That kicked in as the worst. So that we're still dealing with now. I think I saw her last at the beginning of April, but she was in a rush because I kept her waiting too long, so I didn't get to photograph her for the last one. Next slide. Yeah, that's it. So that was it for that case. So in terms of, and this next case, please no pictures. This is a good friend of mine. Any comments on laser burns and skin of color from the panel?
Yeah, you mentioned Cyspera, which really is so helpful. Are you still using hydroquinone? Do you layer that in?
Yeah, the vitamin C hydroquinone from Obagi, the drops I use, and I limit what they can use, because if you don't tell them 1/4 of a drop, a half a drop, that type of thing, they'll use like half the bottle, and then they'll get significant irritation, and then they'll blame it on you. So I tell them 1/4 of a drop, I write it, and then I make them take a picture of it on their cell phone, what I've written, because I'm like a beast about stuff like that. Oh, you didn't tell me that you were talking so fast. Yes, I talk fast, but the people that I see are also very smart too, so they can follow me,
I think your treatment was excellent.
Thank you.
Just some of the points that I'm sure you did that I think may be helpful for the audience is when you see patients like this, just establishing that there is not a quick fix for this. Everybody wants this to be fixed today because they have a wedding coming up or something else. So part of the discussion is almost always, we're going to manage you and help you recover, but we also need to help you camouflage what's going on so you can go on about your day-to-day
I had
life.
her use Dermablend too, so you can go to dermablend.com. Macy's sells it. And so, yeah, you're right, because she's a doctor. She needs to look a certain way. Yes, my friend. How are you, Sahar? I call you melanin rich. I call you melanin rich skin, nonetheless.
But anyway, what you're showing of the laser and how it affected the pigmentation. Yes, we do see this a lot in the Gulf area, and the thing is that even applying sunblocks for every 2 hours is actually not quite enough, because the heat there, we go by Celsius, so we can go up to 40 or 50 Celsius, and it's all the time, all the year round, it's sunny. So putting some covering, which is light in color, may protect even better. And I approve with you that getting the pigmentation down will cause a lot of depigmentation at first. And for the depigmentation to repigment, That what takes the time. So makeup is
Critical.
virtually important for that. Yes.
Thank you.
Thank you.
Thank you, darling. Really quickly, I want to fly through this radius because I'm out of time. So this is a friend of mine, and look what I did to him. Next slide. So he had come in my office, let's pick a Tuesday, and then come back in on the Thursday for a little more radius. And this is 0.1 cc's, and it was the last stick, and I saw a flash of white, like a sail. And after I changed my pamper, I went into action, and I was flushing him with saline because it was radius. That wasn't really working. I flipped his mouth open, guys, and I slashed, I don't even know what, a section of the angular artery inside his mouth, and that's where you see that cut, and the whole bottom of his face pinked up immediately, so I didn't have to deal with that. But I actually flipped his mouth open, because you do what you can in that moment, and like I said, he's a friend, and I was horrified. Look how much worse I made him. Keep going. Okay, so that was the day of the complication. Keep going. This is 1 day post. I was having a heart attack. I've never had this happen to me before. Keep going. That's day 4. Okay? Is that not horrible? A friend, mind you, like going out to dinner, going on vacation, like, holy crap. And he's like a big speaker and well-known, and of course, you know, all of that. So, not fun. Anyway, next slide. Day 7, looking a bit better. So this was, I'll show you guys everything I used in a minute. Keep going. Day 21, looking much better, more like himself. Even had like his smirk back on his face a little bit, thank God. Keep going. 2.5 months post, you can barely tell anything happened. I still, this is 2011, Ken Beer and I call him my Jewish brother, we published a paper. We both had radius occlusions within the same week of each other because we like to do stupid things the same. And so we published a paper a year later in 2012 on everything we did. Next slide. So this is the stages. I can't even look at that. Next slide. And then this is him 7 years post. So he forgave me. Keep going. This is what I used. You guys should take a picture of this slide. Give me credit and give Ken credit. This is all from our 2012. I think it's really important, and this is everything I did. No ice, nitroglycerin paste. I did Viagra. He's like, thanks a lot. I did the prednisone, multiple Fraxel laser treatments, saline flush, hyaluronidase, hyperbaric oxygen. His insurance paid for that. That was nice. 10 treatments. I did subcutaneous low molecular weight heparin, aspirin, antibiotics, antivirals, warm compresses, massage. I forgot to put prayer up there. I went to his house. Next slide. I gave him full access. I went to his house basically twice a week. You guys can take pictures of this as well. I had somebody with me at all times. I didn't want to be accused of impropriety at all. I gave him free product for almost 2 years afterwards, and I treated him with complimentary Fraxel. I have other cases, but I'm completely out of time, so I'm so sorry. I just wanted to know, I wanted you guys, just one more slide here. This STS does not work that well. Next slide. It is not really a rescue. It says it degrades at 100%, but it really, honestly, is not that helpful with radius at all. If you see a radius occlusion from another person and it's not you, send them back to that other person. That would be my best advice. Comments from the panel?
The fact that you jumped in and slashed open the artery, I got to tell you, that's why you want to be treated by a doctor and not by, can you imagine, in a clinic?
Slashing the artery.
Yeah, I was not. I mean, I was just like, I saw my life flash before me. I think hyperdilute radius has its place. I don't use radius in the face anymore. I use a ton of Sculptra. And like I said, I do constant clinical trials on everything, but I do not think this STS works the way that they say it does at all. I mean, obviously with
Totally
Voluma, I use which one? Vitrace. Okay.
Totally.
Thank you guys. Thank you for your attention.
Thank you so much.